Onc Live Insights is a video editorial program produced by Onc Live.
Until very recently, there have been relatively few treatment options for patients who have advanced carcinoid tumors. The PROMID study was a study that looked at octreotide in patients who had advanced carcinoid tumors. And that study showed that for patients with advanced carcinoid, treatment with a somatostatin analog, in that case octreotide, can help slow tumor growth. So that was one option. Very recently, we now know that everolimus is effective in patients who have advanced carcinoid tumors. Based on the RADIANT-4 study, we know that everolimus can help slow down tumor progression. One of the treatments that hadn't been looked at as definitively is angiogenesis inhibition. We know that it can be effective in pancreatic neuroendocrine tumors, but that question hadn't really been answered in carcinoid tumors. There was a recent study called SWOG 0518 that tried to look at that question. That was a study in which patients who had advanced carcinoid tumors were randomized to receive either treatment with the angiogenesis inhibitor bevacizumab or another treatment, alpha interferon. The results of that study were interesting because it showed that there was no treatment between the two arms. So we don't really know how to interpret it. One might interpret it to say that neither treatment was particularly effective. My interpretation of that study is that the activity of bevacizumab and interferon is actually quite similar in patients who have advanced carcinoid tumors. Neuroendocrine tumors have long been known to be quite vascular, and there's been tremendous interest in looking at angiogenesis inhibitors as a potential treatment. We know that sunitinib is active. There is another tyrosine kinase inhibitor that is also very highly targeted to the VEGF receptor that has been of great interest in patients with advanced neuroendocrine tumors, and that's pazopanib. Pazopanib was evaluated in a single-arm phase 2 study. That study showed that there appeared to be activity in pancreatic neuroendocrine tumors and also suggested that there was some activity in carcinoid tumors. Based on that study, pazopanib has been taken forward in a randomized phase 2 study. This is a study that's being performed by CALGB Alliance in the cooperative group setting. It's a randomized phase 2 study. Patients with advanced carcinoid are being randomized to receive either treatment with pazopanib or treatment with placebo. We're very excited about that study because it may be the first to demonstrate that treatment with a tyrosine kinase inhibitor like pazopanib is effective in patients who have advanced carcinoid. One promising approach to treat patients who have metastatic neuroendocrine tumors has been using a strategy where a radiopeptide is attached to a somatostatin analog, and the somatostatin analog is then used essentially to deliver very targeted radiation therapy to the tumors throughout the body. That's a strategy called PRRT. The NETTER-1 study was really the first randomized prospective study to formally evaluate PRRT in patients with advanced neuroendocrine tumors. Patients in the NETTER-1 study had advanced carcinoid tumors and then were randomized to receive either treatment with PRRT, in this case a treatment called Lutathera, or treatment with high-dose octreotide that was not radiolabeled. The NETTER-1 study showed that treatment with Lutathera is associated with significantly improved progression-free survival. It shows us that PRRT is a very effective treatment for these patients, and I think that PRRT will be playing a big role in the treatment of patients with advanced neuroendocrine tumors down the road. One of the things that can happen to patients who have advanced carcinoid tumors is that they can become symptomatic from the carcinoid syndrome. The carcinoid syndrome is manifested by flushing and diarrhea, and we've long known that the carcinoid syndrome is caused in large part by high secretion of serotonin by the tumor. Carcinoid syndrome has been treated over the past several decades with somatostatin analogs, and we know that somatostatin analogs can be quite effective in that setting. But over time, patients who have carcinoid syndrome can become symptomatic despite using somatostatin analogs. They can have breakthrough symptoms, particularly breakthrough symptoms of diarrhea. So there has been interest in looking at direct inhibitors of serotonin to treat patients who have carcinoid syndrome. The Telestar trial was a trial that looked at a drug called telotrestat etoprate. Telotrestat is a tryptophan hydroxylase inhibitor that inhibits serotonin synthesis. And in the Telestar trial, patients who had carcinoid syndrome and diarrhea, despite being on somatostatin analogs, were randomized to receive either 2 different doses of telotrestat or placebo. The Telestar trial showed that treatment with telotrestat significantly decreases bowel movement frequency and diarrhea in patients who have carcinoid syndrome. And it looks like telotrestat will be a very promising drug in the future for treatment of patients who have this condition.